Parents, listen up. A popular kids snack pack could have lead in it. A consumer watchdog group found that Lunchables, at least the Lunchables they tested, have potentially concerning levels of lead and phthalates. Those, by the way, are used to make plastic more durable. They're not good for the human body. The group also says it also has high levels of sodium. Consumer Reports is petitioning the U.S. Department of Agriculture to pull Lunchables off school lunch menus. Public schools introduced them across the country last year, and the manufacturer says that they reformulated the school snack to have less sodium. But Consumer Reports found the levels are higher than the ones that you find on grocery store shelves. The group also found that Armor Lunch Makers, Target's Good and Gather, Greenfield National Meat Company, Oscar Mayer, and P3, all of them, they also tested positive for heavy metals. Now, you've had at least one of those in your lifetime. So the question is, what does that mean for your health? I don't know, but I know somebody who does. Her name is Dr. Yolandra Hancock. She is a pediatrician and a health and wellness expert. Welcome back to theGrio, Doc. Talk to me about this. How worried should we be? I mean, what does it mean for children or adults who are used to one of these being a quick snack? If they're eating these things once a day, what does it mean?
I think we definitely need to pay attention to it, both in terms of the ingredients that you mentioned. Lead, cadmium is another heavy metal that they found in it, and these chemicals called phthalates. There's an entire family of them that you mentioned come from plastics. By itself, none of these products have exceeded the limit, but they've come close. At least 3 of these pre-processed meals compose about 70% of the limit of lead that we collectively should be exposed to. And as a pediatrician and mom, when I hear that, it makes me even more concerned for our children. We know that particularly for heavy metals and phthalates, these accumulate in the body. So it isn't that one-time hit, but it's children at their school hour eating these every single day, and then mom or dad or grandpa or grandma giving another one as an afternoon school lunch snack. That all adds into the system. We know that lead and cadmium can affect a child's ability to learn. It impacts brain and nervous system development. When it comes to phthalates, it interferes with our hormone development, resulting in things like allergies at best, at worst, cancer and infertility. So it isn't as simple as, well, we don't exceed the limits. The question is, cumulatively, what impact will this have on our collective health, but specifically on our children's health?
That is quite helpful. Also, your pronunciation of phthalates, because I said a word that didn't sound nothing like phthalates. So that's why I ain't go to medical school. Okay. Former NBA player Nate Robinson says he doesn't think he has much longer to live. The 3-time slam dunk champion opened up about his renal failure diagnosis in 2022. He's been using a home dialysis machine, but he says he needs a transplant. Or if he doesn't get it, he won't survive. Dr. Yola, what does kidney failure do to the body?
The kidneys themselves serve a very critical function. If they don't work, then it ends up causing us to have a buildup of fluid in the body, a buildup of waste and chemicals in the body, even an inability to balance our electrolytes. Unfortunately, the early symptoms of chronic renal failure don't show up. You don't feel sick. In the same way hypertension is a silent killer, so is chronic kidney disease, unless you're getting a routine test. As the disease progresses, you develop what we call nonspecific symptoms. So you might feel nauseous, you might vomit occasionally, you might have leg cramps. At worst, you may have chest pain, you may have difficulty breathing because of a buildup of fluid. One of the challenges that if you do not go in to have an annual checkup, we can't test your kidney function to see what's going on, especially if you are at high risk. So individuals who have diabetes, individuals who have high blood pressure, heart disease, or if you are a smoker. And if you're thinking about it from a race standpoint, African Americans, we are at higher risk of kidney failure than our non-Black counterparts. And so it's important for us to go get those routine checkups and get your kidney function tested.
All right, we're now finding out that a biased test kept thousands of Black people from getting kidney transplants. Doctors say a widely used test may have been underestimating how well Black people's kidneys were functioning. The test used an automated formula. Now, that formula calculated the results for Black and non-Black people in different ways. And so this led to a delayed diagnosis of organ failure and evaluation for a transplant. Doc, I literally have 20 seconds, but this is another reason to scare Black people away from the doctor for me.
Unfortunately, but it's when science goes wrong. We assumed back in the day that Black people had more muscle mass than whites. That increased our creatinine levels, and that's part of the number that's used in this calculation. We now know, based on science, that we don't have more muscle mass than white people, and to use that as a defining characteristic for a renal transplant is wrong. We can't throw the baby out with the bathwater. We still need to use race and creatinine levels because it also allows us to have access to certain medications for diabetes that we otherwise wouldn't if we simply base it on those numbers.
Dr. Yolandra Hancock, thank you as always for your insights.